Breast Augmentation by Dr. Iraniha from Surgical Oasis Institute.
Hi guys, I'm Dr. Iraniha from Surgical Oasis Institute. I'm a board certified general surgeon who has been in practice for more than 2 decades in Southern California, Orange County. And I have dedicated my practice to body contouring. As part of my practice is breast augmentation and breast lift. Today I want to talk about breast augmentations, the indications and the type of implant that we put in, and then we're going to talk about the technique. So let's talk about the indications for breast augmentation. Obviously, there are a group of people that they naturally have a smaller breast, especially in a younger population, that they want to have a breast enhancement or augmentation. There are a big group of patients who had multiple pregnancies and breastfeeding, and therefore they had a deflated breast and they want to have improvements on their look and appearance. We have also people who present for asymmetry on their breast and needs to be fixed, and sometimes you can do that during the breast augmentation to make the breast more symmetrical. People who lose a significant amount of weight, they develop significant sagging of the breast and deflated breasts, and they have interest to have breast augmentations and enhancement. We also have people who go under surgery for breast cancer and they lose part of the breast, or go under complete mastectomy, which is removal of the entire breast, and they also need breast reconstructions or augmentations. Obviously, the abnormal looking breast or deflated or small breast has in some people create in lack of self-confidence and insecurity, which is another reason for some group of people to get breast augmentations or breast enhancement. So the breast augmentation procedures restore the volume of the breast. It also gives the patient more fuller and perkier breast. It's improve the overall shape of the breast tissue, which is very important, especially in people who whether had a significant weight loss and they had a sagging breast, or after pregnancy or breastfeeding develop a deflated breast tissue. Overall, it gives the body more balanced figure, and if there is asymmetry in the breast tissue, it might be resolved significantly during this type of procedure. It's give the patient more youthful breast, which improve their self-confidence as well. In people obviously who underwent a cancer operation to resect one portion of the breast or entire breast, it also gives them the volume and shape back and restore their figure. So in this talk, I'm going to just talk to you about the breast augmentation. We're not going to talk about the breast lift. And the breast augmentation normally happens with 2 different techniques. One is the fat grafting, which we basically harvest the fat by doing liposuction from the area that are undesired, like for example around the abdomen, flank and back, and then we inject that in the breast tissue to give perkier and more fuller breast tissue, and that way you can enhance the breast with the fat grafting. The other technique is placement of the actual implant, that we create a pocket and place the implant in that area to give you the breast augmentations that you desire. The type of breast implants are 2 main types. One is the saline implant and the other one is a silicone implant. So they both have is silicone gel, but the saline implant is the one that we inflate that sac, the silicone sac, with the saline, but the silicone implant comes in pre-filled with the cohesive silicone. And the saline implant is slightly less expensive. It's much easier to place. The incision is much smaller because it's deflated initially, and we place that into the pocket and then we inflate it, and that way you can even adjust the volume. So those are advantages of the saline implants, but unfortunately it does not have a natural feel, a natural look, and also it has a higher risk of developing rippling around the breast, which is very unsightly for some of the patients, especially during the movement and activity or exercise. And also the risk of deflation of the saline implant is higher. Silicone implant is a little bit more expensive, but it has a very natural feel and look to it when you place it under the muscle or above the muscle in the breast pockets. And then it requires a little bit larger incision in order to put it in. It's pre-filled, so you cannot adjust the size during the surgery. Silicone implants come in a different shape, but the more common shape that people use throughout the world is the round shape or a gummy bear or anatomical shape. The gummy bear and anatomical shape is used for mostly people who underwent cancer operations, and they have mastectomy, and that gives them the full shape of the breast, but the round is most commonly used in a normal condition for breast enhancement. So they come in a different size and a different profile. The profile is the height of the breast implant, which is from the bottom to the tip of the breast implant, and they come in a different projection, like a low, moderate, or high profile, and also come in a different texture. For example, some of them, they have Velcro texture on them, and the other ones are very smooth. And the majority of implants that we use in the United States are smooth round implants. Now let's focus on the most common questions that are asked during the initial consultations for breast augmentation. Patients are very curious about the incisions. They're curious about the location of the breast implants, the type of the breast implants, their shape, the texture, and also the volume and projection. As far as the incision, there are three main type of incisions that we use in order to place the implant. One is called peri-areolar, which is around the areola and the nipple. The other one is submammary, which is in the fold below the breast. And the other one is in the axilla, which is the line that we do in the armpits, and create a pocket to place the implants. But my preference is the submammary incision. That area you have a beautiful access to the whether put the implant below the muscle or above the muscle, and also you prevent touching the nipple, which has the higher risk of contamination during the surgery. And decrease the risk of infection with this type of incision. You have a better visualization of the pocket from that incision, and at the end this incision is very well healed, and normally people do not see it because the breast basically falls over the incision and it would be essentially invisible. The location of the breast implant, two main ones is one above the pectoralis major muscle and the other one below the muscle. So above the muscle or below the breast gland is one technique, and below the muscle or submuscular is another technique. In majority of my practice, I place the implant below the muscle, and that gives you a very nice natural shape of the breast after placement of the implant. There are female that they are athletes and the bodybuilders that they use the muscles, and they cannot afford to have any weakness of that muscles, and then we have to put the implants above the muscle, but it eventually has a less desirable natural shape to it when you do that. As far as the type of the breast implant, my preference is the silicone round and the smooth implants. That implant has very easy to place. It is very desirable when you put it in. It follows the natural anatomy of the patients and gives you a natural shape of the breast, and also has less documented risk, especially ALCL, which is anaplastic large cell lymphoma, that is been associated with the texture breast implant. So my preference is a silicone round and a smooth breast tissue. But as far as the size and profile, it really depends on the patient expectation, and also most important thing in their footprint and their anatomy, how much volume that they can accept, and what type of profile is the best suitable for them. As I mentioned, my preference for breast augmentation is placement of the a smooth and round silicone implant. There are a lot of advantages of this type of implant. Number one, it has very less possibility of rippling around the breast, especially medially when the patient moves. It gives you a very natural look because it feels very soft. It is round, so when you put it underneath the breast, even if it moves and turns, it still does not change the appearance of your breast tissue. And also it gives you a better and fuller upper pole on the breast. It creates a better cleavage, and also one of the most important thing is that a smooth round breast implant has not shown to have any association with ALCL, which is anaplastic large cell lymphoma. This is the very rare type of cancer that has been shown associated with the breast implant. And normally we see that on textured breast implants, and it's almost impossible to have that after placement of the smooth. At least it has not been shown yet in the literature. But now we need to answer the most important but very complicated question: is what is the volume of the breast implant and the projection of the breast implant? Obviously, the patient's desire and expectation is very, very important. We ask the patients to come into the office and basically bring some pictures of type of breast and the size of the breast that they desire and they're interested, and we consider that and we get the idea. But the most important thing to determine the volume and also the projection of the breast implant, it really depends on their anatomy and their breast footprint. So the anatomy of the chest wall is very, very important, and we determine that during the initial physical exam. Then I do a drawing of the footprint of the breast, which is basically the area of the breast tissue that is located on the chest wall, which is medial and lateral border of the breast, the inframammary fold, or the fold that is underneath of the breast, and then the upper pole of the breast is marked, and we measure the width of the breast, which is a very important number to determine the volume of the breast implant. And then After the full and comprehensive examination and measurements and understanding the chest anatomy and also the patient's desire and expectation, we come up with the range of the breast implant that is suitable for the patients. We also have breast sizers that we give the patients so they can put it in their bra and look and see if that's something that is close to what they expecting. So that gives us an idea of how we what type of breast implant, what is the volume and the projections. And at the end, we identify a range that is suitable for the patients, and normally I use a sizer in the operating room and basically determine the best volume that I can use for that special patients and to get the final and best. Now let's talk about the surgical technique in a little bit more detail. For breast implants, we usually use general anesthesia. It's an outpatient surgery. It takes around maybe 1 hour or maybe 1 hour and 10 minutes to perform the whole procedure. We follow the 14-point plan guidelines. These guidelines are explained in detail in one of my talk, and if you're interested, you can listen to it on my channel, but essentially these are the steps that we take in order to place the implant safely to decrease the possibility of the short-term or long-term complications related to the breast implants. I create a very small incision in the inframammary fold. It's around 3.5 to 4 centimeter incision, and then I create a submuscular pocket behind the muscle and insert the implants after checking the sizer. So we initially insert the sizer, we check the size, make sure it's symmetric and pocket created nicely, and then we take the sizer out and place the final implant in there and close the skin and put the appropriate dressing. Usually patient gets taped in that area and they get a special bra. As you can see, the result is extremely gratifying and satisfactory. Even right after the surgery, you can see a significant difference from before the operation to after the surgery. This is a young, beautiful lady who had multiple pregnancies and developed deflated breast after breastfeeding, and desire to have a more fuller and natural breast tissue, and we place the smooth round silicone implants, and you can see the breast tissue is very symmetric with beautiful shape, nice upper pull, and 1 week after the surgery, you can see after the swelling goes down, the breast looks very, very natural and feels natural.
If this video was educational and helpful, please like my video and also visit my channel at YouTube, Surgical Oasis Institute. For free consultation, please call 949-646-8444.